Okay, great. Well, first of all, thank you for being part of the town hall meeting this morning. We certainly welcome you from Kodiak. My name is John Whitman, the Chamber President, and so on behalf of the Kodiak Chamber of Commerce, also the community of Kodiak, I'd like to thank you for being here, and we look forward to this town hall meeting. I should say, before we get started, we have a really large representative audience here this morning, plus Heather Morton's 8th grade middle school class will be here. So with that all being said, we'll turn it over to you. Thank you.
Well, John, thank you, and I appreciate all that you and the Kodiak Chamber have done to allow for this venue today. I also want to acknowledge Tom Chera. I hope I'm pronouncing that name right, Tom. I understand that he is the auditorium tech there, and we're all counting on this technology to work for you on your end there in Kodiak and for me here back in Washington, D.C. So we appreciate the technical expertise here. I also want to recognize and thank KMXT, who I understand is broadcasting this. So for those folks who can't come out this morning at the auditorium, they can perhaps listen and gain benefit from this conversation as well. I want to thank all of you who have joined us to share your thoughts and your concerns about health care and health insurance reform. I also want to extend a welcome. I see you in the back there. I think that's the 8th grade class there from the Kodiak Middle School. I want to thank the Kodiak Island Borough School District. It's great to see young people involved in this process, and hopefully you've got some of your own questions out there too, so we'll give a little shout out there to you. I'm sure that many of you had an opportunity to watch President Obama just last week as he addressed the Congress on the issue of health care reform. In terms of some of the specifics that many of us were waiting for, I think there is still a great deal that is yet to be fleshed out. What I did hear from the President was that he continues to endorse the concept of a public option plan, perhaps a co-op. We may learn more about that later. There was put out on the table some discussion about tort reform. I do think that was good. But really, in terms of the details that I think many were waiting for, I think it's fair to say that we're waiting on those. So much of what it really comes down to when we're talking about healthcare in this nation is what we can do to reduce the cost. That's the anxiety that I'm hearing from so many Alaskans. The Senate Finance Committee is underway as we speak. They will likely continue their negotiations, but perhaps as early as the mid to the end of this next week, be prepared with a bill to set out on the table, and that committee will hopefully begin their markup the week of September 21st. That will provide us perhaps the first real detail as to how close the President's speech will incorporate the legislation that is advancing. What I've heard from Alaskans over this past summer on health care and the issue of health care insurance, the feedback has been really quite considerable. I've heard from probably in excess of 5,000 Alaskans in various forms, whether it's through emails or faxes or letters, phone calls. Many have expressed a concern with the rush that health care reform is moving through the Congress and the President's request to have something signed by the 15th of October. I've also heard from many of you who are very, very concerned about the massive federal spending that we're seeing, putting at risk our children's generation, future generations, when we're looking at literally trillions of dollars in federal debt. Many have expressed an opinion on a government plan. Others have opted not to join that part of the discussion, but have raised concerns about the costs of your premiums that you and your family face. You're seeing increases, double-digit increases every year, and you rightly want to know, well, what is this reform legislation that's moving forward? What is this going to do for me and my family? What's it going to do to reduce costs? What's it going to do if I like my health care insurance? So regardless of where you're coming from on this issue today, I want to hear from you. I want to know what it is that you are thinking. I believe you have all been presented with a packet of information. I've used this as I've talked to Alaskans in the 4 town hall meetings that we've had previously in Anchorage, in Fairbanks, in the Mat-Su, and on the Kenai. I just want to take just a very couple brief minutes to walk you through what I've presented you, because this helps give you some sense as to where I was coming from when, as a member of the Health, Education, Labor, Pensions Committee, we moved a bill out of committee in July, and I voted against the bill. Well, these are some of the reasons and some of the things that I thought were pertinent. On the first page, you have a graph that shows the exponential growth in healthcare costs. And part of the reason for this is we've got new technology, and quite honestly, people are living longer. But part of this may be due to unnecessary costs such as duplication of tests, the practice of defensive medicine, the lack of primary care, which results in overutilization of specialty care. So in order to look at why our premiums are increasing, I think we need to look at how we're spending money on health care. The second graph that you have there includes a historical Medicare cost. These go back to 1985. It shows how much CBO predicts that Medicare costs will grow without any changes to policy. You can see, as you look at that curve, the increase there is astronomical. The orange curved line at the bottom shows you what happens to Medicare in the year 2018. Basically, Medicare goes bankrupt. On the next page there, you've got the federal spending list. And this is a look at what's been going on in Congress in terms of our spending in just the last 19 months. I think this is one of those charts that there's a lot of folks from Fairbanks to Anchorage, the Valley, all over, where people are saying, what are you guys in Congress doing? You're spending a heck of a lot of money. And I'll remind you that that chart that you're looking at, when you add in the potentially $1 trillion in healthcare costs, we're looking about over $3 trillion in government spending in the past 19 months. And we're not counting in the regular spending bills that we in Congress pass every year. You have some comments there from the Congressional Budget Office. This is the neutral official government scorekeeper. They do an assessment, do an analysis of what the legislation costs. You can read those yourself. Excuse me. The next chart that you have there is a pie chart using the U.S. Census data, breaking down the number of uninsureds and who they are. I think that's a particularly interesting one to talk about, because as we talk about the need to cover the uninsured in this country, I think it's important to recognize there are some groups that have access to insurance who choose not to avail themselves of it. You have another group, those who are here illegally in this country, who I think most people would agree should not be covered under this plan. So that's an important chart to be looking at. There's also a provision there relating to ICER's comments, the Institute of Social and Economic Research there at UAA, in terms of the impact with those on Medicaid and the significant problems, Medicare, the problems that folks have in accessing providers, those that are on Medicare themselves. And then the last chart that you have there relates to Medicaid. The provisions that we're talking about here in Washington would allow for a Medicaid expansion. And the estimates that we have, right now the state of Alaska spends about $1 billion on Medicaid currently. If the proposed Senate Help bill is passed, Medicaid would be expanded. It would cost the state about an additional $91 million every year, somewhere between 91 and perhaps 128, depending on how we expand it. So I think it's important to recognize the cost to the state there. And then the final page that you have there is the outline that I have included in terms of the things that I believe are important in any healthcare reform that we undertake. We have to have a guarantee that insurance coverage will be available to those with pre-existing conditions, such as diabetes or heart disease or mental illness. This is an area where Republicans, Democrats, the presidents all seem to agree we must enact this insurance reform. We must also ban the insurance companies from denying claims or canceling coverage because of newly detected health conditions. I'm not going to repeat what you have in front of you there. I think it's pretty self-explanatory, but I think it is important that you know kind of what my must-haves are as I look through the various proposals and work with my colleagues to develop healthcare reform that is meaningful, that does reduce costs, that does increase access, and does improve the delivery of care to people all over the country, whether they be in Kodiak or all the way to Maine. I apologize for my raspy voice. I've been fighting a cold, so I will now turn the program over to you, John, and have you begin with our viewers here, and we can ask some questions. I understand the ground rules have been laid out and folks understand how we will proceed. So I will kick it back to you to choose someone for the first question.
Great, thank you, Senator. And thank you for your remarks, and we'll give you a chance to have a glass of water here. Again, just a quick reminder, there'll be 2 minutes for questions, and I would ask, if you wouldn't mind, please, if you ask a question, introduce yourself so the Senator can actually respond to you by name. It may really help. So with that said, we're ready for the first question. So, right here. Need a microphone.
Hello, Senator. Is it on? Yes.
Yeah.
Hello, Senator. I have heard this morning in the news that one of the options for initial financing of health reform is to appropriate $425 billion from Social Security. My husband and I already helped to support elderly parents whose retirements were devastated by the economic collapse last year and who are now even reliant on Social Security. We also already purchased our own insurance for our family of 6. Senator, what will you do to ensure that the middle class does not end up bearing the brunt of the cost for reform, and that the Social Security funds are not appropriated to this end?
Well, I appreciate the question, and I think it's important that as we discuss healthcare reform and how we will provide for meaningful reforms in this country, we make sure that we do it responsibly, that we don't put it on the backs of small business, that we don't take it from the seniors, whether it's through Social Security or whether it is through cuts to Medicare. We don't cannibalize from other government programs in order to pay for a brand new government program. I think those that I have been talking with around the state have said to me, you know, if in fact this new government program is going to be built, modeled after Medicare, and here in the state of Alaska, Medicare just isn't working for us because we don't have sufficient providers, we really don't have a level of meaningful access. Tell me why we would build a new system on the back of a broken system. Why wouldn't you fix Medicare first? And that's a perfectly legitimate question, and it's absolutely the responsible thing for us to do. So when we talk about how we're going to pay for healthcare reform, if you heard the President last Wednesday, he said, ladies and gentlemen, this is not going to add a dime to the deficit. Well, I will support the President in that. But I will tell you, I'm not quite sure how he's going to be able to keep that pledge and not take from seniors and from Medicare and not place the burden on the back of small businesses. There is much that we can do within our existing systems to eliminate the waste, fraud, and abuse that goes on. And I agree that that must be one area that we look to. But to suggest that we might be able to find $900 billion in waste, fraud, and abuse, I think if there's really that much out there, we would have been rooting through that diligently prior to this point in time to help piece together some of the reforms that have been needed to be had for some time. So the assurance that I can give to you is I am not going to support a reform that, again, is built on the back of a broken system or that jeopardizes the security of seniors that have paid into the system their whole working lives to find that it may now be jeopardized.
All right, thank you, Senator. Stacy.
My name is Stacy Suda-Baker. I've lived in Kodiak for about 30 years, and I'm a retired high school teacher. Like the majority of voting American citizens, I believe a public option is vitally important to any new health care plan that is adopted by Congress. One of my biggest concerns about the present debate is the enormous amount of money from the healthcare insurance and pharmaceutical companies that is driving the opposition to the public option and clouding a civil, intelligent debate with misinformation and very loud, violent, and mean-spirited rhetoric. My concerns also involve the millions of dollars from those companies contributed to U.S. senators and representatives to kill Obama's plan. In the spirit of full transparency, and with all due respect, I would like to know where you, Senator Murkowski, stand in that regard, to know who you are truly representing. How much money have you taken in contributions from the healthcare insurance companies and pharmaceutical companies? Thank you.
I don't have the number, although I'm certain that I have received donations to my my campaign over the years from pharmaceutical companies. That is a matter of public record and is accessible, and if you don't have that information, we can make that available to you, but I don't know what it is off the top of my head, nor do I know what any other industries have contributed to my campaigns. As far as the influence that is out there by interest groups, I will not deny for a moment that the lobbyists on all sides of this issue, whether you're in the insurance industry, whether you're in the pharmaceutical industry, whether you're part of the American Hospital Association, or whether you are a trial lawyer, believe you me, everybody who's got an interest in the healthcare debate has got their paid lobbyists out on Capitol Hill. So I'm not going to stand or sit here today and deny that there isn't a full court press on this issue, just as there is when we have the energy issues before us. But there is a lot at stake here. And I think we recognize that when you are seeking to change a system, then interests that have been comfortable for a period of time get a little anxious and get a little nervous, and they get involved. But I think it's important to recognize that, you know, for instance, let's take the pharmaceutical industry, because you have singled them out. The pharmaceutical industry has come forward, I think at the President's request, and basically said, you know, what are you guys willing to put on the table? He asked the hospital association the same thing. What are you willing to give in this discussion and this debate? I am not one of those that believes that the best thing for this country is to ignore the rising costs in health care and just wish this away. I am one who believes that we need to see reform in this country, that we need to see some changes, that the status quo is not acceptable. I will argue on the same side as the president as this, that in fact doing nothing is not an option. And I'll stand behind that, and I will work towards finding something that works for all of us in this country. I don't happen to believe that a public option is the best option for us. And there are many Republicans, and there are quite a few Democrats as well that would agree with me on that.
Nick Szabo.
Yeah, Frank Senator, my name is Nick Szabo. Well, I guess I'm not completely sold on a public option, but 35% of us are on a public option, whether it's military or government or Medicare. And you said that Medicare, you didn't think Medicare was working. Well, I recently qualified for Medicare, and I underwent 2 minor surgical procedures at our local hospital. Each one took about an hour each. The total bill was $20,000, and Medicare paid all but $15 of it. So I'm pretty happy with what I got out of Medicare.
Well, and it's important to recognize that Medicare and the ability for those who are Medicare eligible to access providers is not entirely equal throughout the state. In Anchorage, we've got a situation, you got the state's largest population center, and in Anchorage, we do not have a sufficient number of providers that are willing to take Medicare-eligible individuals. And what is happening is a situation where you've got somebody who turns 65, they've been seeing the same doctor that they've had for 15 years, but on that 65th birthday, the doctor says, sorry, because of the reimbursement issues, I am not taking Medicare-eligible individuals, and they drop the patient. When I was up at in Fairbanks and attended the town hall there, one of the concerns that I heard from a woman was her job was going to relocate her to Anchorage. She had her mother who was living with her, and her mother's doctor said, don't move to Anchorage, because here I'm continuing to see Medicare-eligible individuals, but getting your mother in to see a doctor who will take new Medicare patients is almost next to impossible to find. The one place you can go in Anchorage where you can get in is the Anchorage Neighborhood Health Center. Otherwise, it is almost to a point where people say it's a crisis. Now, in places like Kodiak, where you have you've got providers that have been there for a period of time, made that commitment to the community, I think we're seeing different things. I had the same conversation with people down in Ketchikan saying, we're not having that access problem. But I think it's important to recognize it's not just in Anchorage, it's not just in parts of Alaska, it's in other parts of the country as well. We're seeing it predominantly in rural states, although Washington, Colorado, New Mexico, these are some of the states that have been identified as states where there is a real access issue when it comes to Medicare providers. So much of this comes down to the reimbursement side of the equation, and whether or not doctors are able to continue to meet their overhead given the very skimpy reimbursement rates that they get from Medicare itself. So it ought not to be a situation as to where you live as to whether or not your government system, and you're absolutely right, we've got Medicare, we've got IHS, we've got the VA system. We have examples of government-run health care, but it shouldn't be a situation so much of, well, the government plan's not going to work for you if you don't live in the right spot. So I want to make sure that this is a system that works for all.
Right, thank you. I have several questions here, folks. I'll get to them as quick as I can, but I'd like to change for 1 second. I have a writing question I'd like to read, and this actually came from Dr. Withrow, so I think bear with me if I do this. And Dr. Withrow has actually left, as he told me just now. He has to go and practice medicine right now, so he can't be here now. But he actually doesn't have questions. He actually has comments. I think these will be worth contributing. So I'll just read his entire message. It says, Senator Murkowski, I may not make a teleconference. He actually did. He's left. I'm back at the ER call. I have an admission. I've lived in Kodiak for 34 years as a general practitioner, and I share people's concern for the future of healthcare in America. I believe it's not enough to just complain. It's necessary to contribute. As you, Congress, President Obama make decisions about healthcare, I'll contribute 2 criteria and 1 caveat that would make part of any changes. So they are. Criteria 1, eliminate greed. To paraphrase a Supreme Court justice, you'll know it when you see it. Too much of healthcare is money-driven. This is coming from Dr. Withrow. Eliminate the motivation to make people rich from healthcare. Criteria 2, maximize quality. Many health interventions are evidence-based. They're actually unproven cost-effective treatments. Pay for these. It is not yet proven. Pay for these patient and enroll in a study to see if these therapies actually work. Unproven, unnecessary treatments, reordered, the patient will have to pay for them. So eliminate greed, maximize quality. And the third part of this caveat is medical students must be taught to follow through on these first 2 criteria, which is eliminate greed and maximize quality. So any comments you might have about that?
Well, let me speak to the quality issue, because right now we've got a system that really doesn't reward for quality. It pays and rewards then based on quantity, on the number of procedures that are done, not necessarily on the outcomes, or not an approach that would be considered, say for instance, more holistic, a more patient-centered approach, a more coordinated care approach. You basically get paid for each different procedure that you get. So I know that the doctor's first point was we need to eliminate greed, and I think we would all agree that it's a great place to be starting. But even if we say, okay, well, we've got to eliminate that, the doctor still has to pay for his or her overhead. He's still got to make sure that the receptionist is getting her paycheck. He still has to pay a mortgage and pay for his family. So we've got a system, a healthcare system that, and I don't even usually call it a healthcare system. It's a sick care system. We will help you. We will cover you when you are sick, but we really don't do much to help keep you from getting sick. This is where one of the areas of reform needs to be focused, is what can we be doing in a more proactive manner to focus on the prevention, focus on the wellness. We shouldn't be charging you co-pays for instance, for your screenings, whether it's for a mammogram or a colonoscopy. We can be doing more within the system, but it's such a rigid, such a siloed type of a system that we have, and the way that you get paid when, for instance, you're being reimbursed on Medicare, it's pretty prescriptive. And so I don't disagree with the doctor. I think he's got some good points there. his last point about making sure that the new medical students who are coming in and the docs on the up and coming, we need to be doing more in Alaska to be encouraging more providers to be coming here as well to be learning those lessons. So I thank the doctor for his remarks.
Thank you.
Yeah, unless you have more, could you take your mic over there? John, just a moment.
Okay.
Hey.
How do you feel about the profits, the sale?
Volume again.
Stand by. I think we're losing audio in every regime. Yeah, so
Okay,
I think we're back.
I think that's better.
I think.
Losing audio on what? You want?
Okay, I was wondering how you felt about the profits, the salaries, and the bureaucracies that exist within the insurance companies and the pharmaceutical companies, and the amount that they contribute to the rising healthcare costs.
I do believe that in fairness, we're seeing, whether it's the insurance companies who are very profitable right now, I think we're seeing our pharmaceutical companies that are profitable, but we also recognize that at the same time we want the pharmaceutical companies to be innovative and to develop these new drugs that we want to help us in all of our procedures and life-saving measures. You want to make sure that they can make a fair profit. But I think that the comments that are raised in terms of the amount of profit that is out there, whether it's within the insurance company, whether it's the pharmaceutical companies, I'll tell you one thing that really gets my goat. I read the Washington Post here in D.C. It's delivered to my home every morning. I think every day, without fail, there is at least a full-page ad from a pharmaceutical company advertising some new drug, and then on the backside it lists all of the dangers that by law they're required to do. I don't know what a full-page ad costs in the Washington Post every single day of the week, but I look at that and I say, you know what? To me, and I understand the issues of free speech and advertising and all this, but I look at that and I say, to me, that's misplaced. Why is that not being put towards greater research to find the cure for whatever it is that we are seeking? I will tell you, I'm hesitant to get into the government telling the insurance company CEOs or the pharmaceutical company CEOs that you can't make over this amount. We're already, as a federal government, far into too much of what I consider to be the private sector when the federal government owns Chrysler and General Motors, and we're setting the salaries for those CEOs. I'm not prepared to intervene as a government that much into the other sectors. But I do think that it is appropriate to raise as issues those areas that we see that there's some pretty expensive spending going on, and you wonder what is the purpose behind it.
I'll try to be fair going back and forth so we can. So Dr. Zimmer.
Thanks, Senator Murkowski, for the opportunity. My name is Paul Zimmer, and I'm a family physician. I've lived and worked in Kodiak for 15 years. I really appreciate the thought that you put into addressing this topic. So important, so complex, and it's apparent that you actually understand it, and I realize that. Thank you. I think it's appropriate that our government step in now, reset some of the ground rules and incentives in our healthcare system. And I think that the strategy you've outlined is a step in the right direction. What does concern me, though, is that all the current proposals I've seen leave intact the complex web of private and public insurance systems that make it so difficult to navigate. And there's a proven model for healthcare that it seems like we're ignoring, and it's the single-payer system that would be based on Canada's system. You know, they pay a lot less than we do. They cover everyone. They have better outcomes, and they have better satisfaction. And to continue with the complex method that we have defies common sense in my mind. It seems to me that there are some things that we can do better if we work together, and that financing healthcare is one of them. I think single payer deserves another look, and your support. I realize that the realities of our system make it very difficult, but I wonder if you could comment on that. And once again, thank you for your work.
Well, thank you, Dr. Zimmerman. I appreciate what you do there within the community. You know, there's a lot of discussion about, well, do we move to the Canadian model? And for as many proponents as we may hear that's the direction we need to go, you hear an equal number saying, you know, don't go there. Again, I was on my way to Fairbanks for the town hall meeting there, and met a gentleman after I got off the plane. His family is from Canada, still live there, and he was relaying the story of his uncle who needed knee replacement surgery, and his uncle was, I believe he was 56 years old, and he basically was told to wait, and waited 4 years to get his knee replaced, and it was not because there was a shortage of doctors or he had to get on some list. Basically, the determination was, you know, and I don't know whether this is true, but the suggestion was a knee replacement lasts about 20 years, and they only wanted to do it once, so they wanted to make sure that he was 60 years old before he did that. Well, as I talk to folks back home, they're not so certain that that's what they want with their health care. If my doctor tells me that, Lisa, it's time to get this knee replaced, let's go ahead and do it, the people that I'm talking with, and certainly within my own family, that's what I want to be able to do. And I'm not so certain that we want the government to be telling us that, well, in order to avail yourself of this through the system that we have, that there is that level of rationing. And those are some of the concerns that we see. I'll tell you, though, it is been an interesting path as we have had the issue of health care hotly on the table throughout this whole summer. I kind of came to the debate thinking that if we're really going to be, if we're admitting that our system right now, we spend too much, and our outcomes are not exactly what we want, and we agree that there are systems that are broken, what is wrong with having full-on discussion about all options that are out there on the table? I'll change the subject since nobody's brought it up yet, but one of the alternatives that has been proposed to a public option is this notion of a co-op. And the details are yet sketchy, although I would expect that we would see something more coming out of the Senate Finance Committee within the next day or so. We're familiar with it in Alaska when we talk about our rural electric co-ops, but the concept of a member-owned, more regional in nature type of an insurance program that could be viewed as providing for a level of competition. You know, when the idea first came up, I didn't know how it might work or apply in the healthcare field. There were some that said, nope, can't talk about it. Or there were others that said, no, you know, we have to stick with the public option because that's just what we have to do. This is significant enough as we debate these issues that we ought to be taking the time to really look to what is out there. I have said in several forums, I'm not an advocate of a single-payer system, but I still want to sit down and talk to those that do feel strongly about it and say, okay, well, you know, share with me, tell me why. So I appreciate your comments, Doctor.
Just while we're coming down here, and the gentleman over here with a question. Just for those, I apologize in advance, there's more questions I know that we're going to have time for, so if you would like to get your question to Senator Murkowski, there's a representative from Senator Murkowski's office, Amy, back here. If you want to write those questions down, if we don't get you, please forward those, please give those to Amy and she'll make sure they get forwarded on to Senator Murkowski. So thank you.
My name is Del Green, and been looking at this stuff through the media and other things, and I appreciate your package. I've learned a lot from reading here today. And my comment, and I guess pretty much a comment, is that through time we've been paying premiums voluntary. We go to the hospital, we pay for elevated emergency room visits because, you know, they're trying to spread out the load of people that aren't paying their premium insurance or the emergency room. So you have two levels of, I don't know, spreading the cost of medical care that's right there. Then we have the tax-based load that's dispersed through Medicare and the other things. And what my big concern is with all of the work that's been going on in this work towards this healthcare plan is that the right of the individuals haven't seemed to be focused on, other than the right to medical care. But there's also is contained in your tri-committee healthcare reform legislation, the mandate on individuals. Now we're seeing that we're removing people's private rights, their economic freedoms, directly from them to pay for the benefits of other people. Now, in doing so, those rights will probably never get returned back to that individual. It's only going to move the one direction. And I guess my question to you is how much emphasis is being put on the protection of individual rights and the ability for people to, if they choose not to have coverage, not end up having to pay an increase in taxes or mandates, or as this is put here as a penalty, for not including themselves into that system. I'm concerned with the degrading of our freedom, and through this myriad or this problem here, I see it as an incredible loss of freedom without people realizing that that's going to happen. Thank you.
I appreciate the question and the issues that you have raised. In the language, the draft language that moved through the Senate Help Committee, not only is there an individual mandate that is placed on the individual, a requirement that you must have health insurance, but there is equally a requirement on the employer that an employer who employs in excess of 25 people will be required to provide for health insurance for their employees, and if they fail to do so, they will be assessed a penalty. The issue that you raise is a very key one. Let's just say that there is legislation that is passed and signed into law that requires that everyone have a level of health care insurance. Well, right now in the state of Alaska, if you're a driver on the road, you're required to have automobile insurance. Yet even with that state law, we know for a fact that in Alaska it's about 15% of the people will choose not to cover themselves. They will choose to ignore the law, and they will basically assume that risk. Well, if we pass this law and say that you're required to have health care insurance, but we haven't done anything to decrease the costs of health care insurance, what makes us think that a penalty necessarily is going to encourage you or urge you to do what we have just passed in the law? We know that there will be people who will basically say it's going to be cheaper for me to pay the penalty to the government rather than to go out there and purchase health care insurance for me and my family. You know, I know that in Kodiak, we've got an awful lot of fishing families. And I know for a fact that there's an awful lot that, that take the risk, assume the chance there, because health care insurance is just so expensive. And is that a dangerous place to be? I think, yes, we all recognize that. But what I would rather get to, rather than say there is a government mandate that will be imposed on you where you must have health care insurance, or you as a small small businesses must cover your employees, and again, you'll be faced with a penalty if you fail to do so. We should be working, rather than imposing mandates, we should be working to reduce these costs so that it is affordable, so that you actually voluntarily go out and purchase the insurance on your own because you know that that's the right and the responsible thing to do for your family. Now, there will be those for whom it is cost prohibitive. And we are working within the constructs of this legislation to provide for a level of subsidies to help those who are not financially able to do so. But I look at the direction that we're going with this in terms of the requirements, in terms of the mandates. And so much of what we're doing with the legislation, at least the legislation that we advanced through the HELP Committee, is government directive, rather than us providing for an array of incentives, trying to encourage people to be healthier so that, you know, that they don't have those costs, trying to work to incent people through different mechanisms, whether it's tax credits or otherwise. So the point that you have raised about individual rights and where do they fit in this legislation or what we're talking about here in Washington is a very, very key one. And this is what I hear as I'm going around from community to community. And people are standing up, and some are very agitated, some are just downright angry and saying, wait a minute, where is the role of the individual and the role of individual responsibility in today's world as we intersect with our government? Why does it seem like there's so much intrusion in what's going on in our life? My response is longer than it should be. But I think it is important to kind of frame some of the discussion when we're talking about healthcare reform into the overall kind of erosion of what we're seeing with personal and individual rights.
Senator, we have actually several questions still to be asked, but unfortunately our time is running short, so I believe we only have time for one more question. And then we'd like to leave some time for you. I'd like to have some closing remarks. So our last question, Ms. Harrington.
Senator, thank you for taking the time to be here today, sort of. We appreciate it. My question for you has to do with self-employed people. Obviously, Alaska has a large number of self-employed people, both in seasonal work and also year-round self-employment. And I'm concerned, we know that in the United States, small businesses and self-employed people drive a lot of economic growth, and a lot of the economic development opportunities in small towns are going to come from one-man, one-woman shops, two-man, two-woman shops. as people manage a lifetime of health care, being at risk for not only losing their insurance, but losing their ability to pay for their insurance because of perhaps illness or just basic body maintenance, maybe a knee surgery that's necessary after 20 years of working on a fishing boat deck. So I see a lot of reform that's related to access to insurance right now, but not much about ensuring that people are going to be able to continue to access health care and not experience a tremendous amount of risk for their businesses. And my concern is that looking forward in Alaska's future, we're going to be reliant on people to be creative and industrious and create new business opportunities and take risks. But we're asking them to also take risks with the health of perhaps their spouse or their children. They choose to leave a job that carries health insurance to go to one that may not allow it. And so I'm interested to hear how you might be able to advocate for our self-employed in Alaska.
It's a very good question, and I think it speaks to the direction that we are moving as a country. It used to be a time when your health insurance was directly tied to your employment. And when you left that job, you left that plan, you left that insurance. And particularly in today's economy where we're seeing layoffs, when we're just seeing a lot of movement within the field of employment, there needs to be a portability of your insurance. I know far too many people that are locked into jobs that they really don't like, but they are concerned about leaving because they fear that if they do so, they will never be able to get coverage again. They may have a pre-existing injury, and if they leave, for instance, their job with the state, if they leave that state job, they'll never be able to get themselves covered. That's one of the must-haves that we must address in any healthcare reform that we advance. And I think the good news for us on this particular point is that is an area where Republicans, Democrats, doesn't make any difference what part of the country you're from, people agree that we must be allowing for a level of portability. I want to hit on the point of small businesses because it's not just in Kodiak that small business is key. In the state of Alaska, about 96.8% of our businesses are small businesses. It's important that they be allowed to continue to provide the jobs and the economic opportunities. So there's a balancing act here. They need to be able to be competitors, if you will, and not fear that they won't be able to attract new employees if they don't have health care to offer as a benefit. But there's a couple things going on. Right now, several of the draft bills out there, the bills that have moved through committee, impose an employer mandate. So under the Senate Help Committee bill, if you employ over 25 employees, you are required to provide for health care coverage. And if you fail to do so, there's a penalty. Well, you're a small business, you're looking at that, and in order for you to meet the government requirement, you're going to have to either pay the penalty and not cover them, which is going to be expensive, or you figure out a way to cover them, but in your ability to do so, you may be looking at lower wages to them as employees. That's not the answer either. And in a letter that just came back to the ranking member of the Senate Help Committee, the CBO director said, you know, that's kind of the direction that you take if you are a small business employee, and you've got to make these choices between providing for that level of coverage or paying the penalty. Now is not the time, particularly in a declining economy, that we want to see the employee receiving less in terms of their take-home wages as well. So there's so much that is at play out there. Again, I think that so much of the answer And this is in response to your question on small businesses, but to so many of the questions that have been raised here today. We've got to figure out those mechanisms where we can truly begin to reduce our healthcare costs. You go back to that very first chart on the handout that you were given, and you look at that growth curve in terms of the costs, and you look at that and you say that's simply not sustainable. What can we be doing better? What can we be doing more? What do we need to do less of? And I think this is where we get to a discussion about how we make improvements to the delivery system, where we're reimbursing or we're making payments to providers not necessarily based on the quantity but based on the quality. How can we utilize some of the really good healthcare models that are out there right now, whether it's the Mayo Clinic down in the lower 48 or what South Central Foundation is doing right in the Anchorage area in terms of really working a coordinated care model, really not only working to increase the patient satisfaction, but really helping to reduce the overall health care costs to the individual and to the system as a whole. There's much that can be done. It's not easy. It's not something that can be done overnight or over the summer. This is going to take a lot of work. And I think if there's any good news that the long summer has brought, and then the town hall meetings all over the country, is that people are really looking at this and they're energized about it and they're involved in it and they're asking questions and they're saying, well, you know, what about this? Have you considered that? And these are good things. We in the Congress need to be looking at the options that are out there. We need to accept the fact that we must be working towards real change, and I think real reform. It may not be doable in one fell swoop, but we must be making those steps so that whether it's an individual that's in a small business looking at how they provide for coverage for their employees and still keep everybody employed, how we ensure that somebody who has a pre-existing condition or discovers something new, that they're not in fear that they're going to lose their insurance. For those who are happy with their insurance and what they have been receiving, that they still are allowed to continue that, and that we as individuals still have that system where I can go in and sit down and discuss with my doctor, and he can make recommendations as to what it is that we need to be doing, and allow for that to move forward without the government intervening, without the insurance company intervening, and a level of health care that I think we in this country hope to be proud of. So we've got a lot of work to do, but they never said it was going to be easy, so we'll keep at it. I would throw out the suggestion that John mentioned to you. Amy Erickson from my staff is there with you in Kodiak today. If you've not had a chance to answer or ask a question today, please give her your comments. Feel free to email my office here in Washington, D.C. Give us a call. But the input that I have received as I've talked to Alaskans all over the state has really been very constructive. Today we've heard a variety of opinions in support of a government option, not in support of a government option, but I think what it speaks to is that we can have a level of discussion and discourse about an issue that I think we acknowledge is very personal and oftentimes can be very, very emotional, but yet we can get some good ideas out on the table. And as one of your lawmakers representing you back here in Washington, D.C., I appreciate the thoughtful input and what you've provided for me this afternoon. So thank you very much. And John, thank you for your help.
Well, thank you, Senator Murkowski. We know we have a busy schedule this morning. There's many unanswered questions, and we will get those to Amy. And again, thank you for taking the time this morning, and thank you for all you do for Alaska. So God bless you.